blazing the trail in curing cancer care centers of Brevard. I'm happy to present the president, Ravi Shankar. And doctor, thank you so much for being with us. Tell me the hopes and the dreams and the progress we're making in this field, because I know you guys are leading on the cutting edge.
Cancer right now is one of the most common diseases, in fact, the killer of many deaths. And I think that we are making innovations in the treatment of cancer in multiple areas: medical oncology, radiation oncology, surgery, and representing cancer care centers of Brevard has really made me very proud. I took over from my predecessor, Dr. Silas Charles. We were 4 radiation oncologists. Now we are 12 physicians, 8 of them medical oncologists, 4 of them radiation oncologists. We stretch from Titusville up to Sebastian, and on any year we see around 400 patients, and I think many of them are very needy, and I think that it's a great chance to grow in Brevard County treating such many cancer patients.
Well, there's the treating of a cancer patient is twofold, isn't it? It's the physical and it's the emotional.
You are correct about it. It's just not treating the cancer alone, but treating the patient along with the family and the community. And that is where I think a multi-speciality group working together helps a lot in these people getting care, as well as after care, after treatment, taking care of their families and other things which need in these people.
Because it's a family disease too, isn't it?
That is correct, and it affects emotionally, socially, financially, economically. Such a diagnosis is what cancer is.
Plus it strikes inside. When you just hear the word, I'm sure that moment that word is said to a patient is devastating.
The big word is C. That's the worst diagnosis one can have. But I think with modern technology and with good education and with societies like, the Brevard County Medical Society, Brevard Indo-American Medical and Dental Association, and the multiple hospitals and the various multi-speciality groups here, I think we're making tremendous progress in the treatment of cancer in this county. And I would say that my hats off to all the physicians who support us in all of these activities which make us do well in the treatment of cancer. Thank you.
I have a judge for you, a Judge A.B. Majid, and I got to ask the question right away. We're at a medical meeting today. Why do we have a judge here?
Well, that's a very good question, because all my friends are doctors, and they love to say that I went on the dark side. I'm the Darth Vader of the group,
I see.
And so in keeping with the Star Wars themes, they say I went on the dark side,
Right. But there are a lot of legal issues nowadays involved in the medical community.
Well, I ran for election in 1992, and when I spoke to the doctors at that time, many doctors said, listen, we don't want to get involved in politics. And I understood that, but here we are in 2014, and there's nothing more political than the delivery of medical care. So we have come full circle. Yes, the delivery of medical care is the hot political topic and the hot legal topic, tort reform, etc. It's very, very big issue.
Right, well, and tort reform for the layman means insurance, really?
Yes, insurance and limiting how much money an attorney can get in a certain suit, limiting malpractice claims. These are very big issues now, and then, of course, with the whole changing of culture, same-sex marriage, all these issues are coming up, and there are many medical issues involved and legal issues involved. So it's a whole new era of law and medicine.
And in your court, you hear what kind of cases?
Well, I'm in the civil bench now. I used to be in the criminal bench because before I became a judge, I was a former felony prosecutor here in Brevard County. And what I do is I hear civil cases. There are a lot of foreclosure cases dealing with banks, dealing with credit cards, a lot of landlord-tenant issues, divorce issues. Like this morning, I had a number of divorces. And so I'm on the civil bench, and I hear mainly civil cases.
Did you by any chance, and I don't want to paint you into a corner, but did you by any chance take a position on the medical marijuana issue?
Well, I really can't take an official position because the issues will come before me. But I can tell you most of the marijuana cases are actually misdemeanor cases where you see many young people with under 20 grams. But there were good arguments for and against, and I'm a strong believer in American democracy, and the people have spoken. I want to take this opportunity to congratulate my good friend, Dr. Stephanie Hyrdopoulos, who's president of the Brevard Medical Society, who's sponsoring this event tonight, and congratulate all the doctors for the fine quality of service they deliver that make the delivery of medical service in the United States the envy of the world.
It's my privilege to introduce the incoming president of the Brevard County Medical Society, and Dr. Devin D. Congratulations, first of all. Let's just do the preliminary here. And is this something that you're looking forward to the next year of serving in this position?
I am. I have a lot of ideas. I want to get going. I want to get us more organized. I want to make the BCMS the go-to place when you have medical issues, medical questions, both for patients, doctors. The other thing,
how accessible are you guys?
we're going to be very accessible once we get the web up and running. In other words, when there's a question about a medical issue coming up, I want the first place that they go to turn to is to one of us, not to the hospitals, not to Dr. Oz. You know, come look to us. We're right on the front edge of everything.
So you're going to have your website is going to be like manned 24 hours, so there'll be always somebody, a nurse or somebody to answer a question?
Give me at least 3 months, and it will be.
Well, there you go. So that's your vision of the future. That's
Absolutely.
where you want to take
Absolutely.
things, all right?
Yeah.
But you must have more things on your agenda too, or things are on your wish list.
Well, I'm a big advocate for physician autonomy. I believe that when physicians are making medical decisions without the pressure of insurance companies and hospital systems, that they make better decisions for their patients. And so I'm a big advocate of the private independent physician, and that's one of my big purposes.
Are you very hopeful that these things can be accomplished, and what do your colleagues say about that?
I think they will be. Everything's like a pendulum. You know, all of a sudden, a lot of doctors are getting hired and unhired. Insurances are bad. Obamacare's here. At the end of the day, it just comes down to taking care of our patients. And if we do a good job at that, everything else will fall in line.
Okay. And is that the motto, the credo that you want is the patient first?
Absolutely. Absolutely. That's actually on my little brochure at the office.
Oh, yeah? Now, again, what is the website going to be, and how is it going to be accessible? You just go right on the...
BCMS.org will be our website. You type that in Google or any search engine, should pull us up, and we'll have access to a list of physicians in the area, different specialties, any complaints you have about a physician, any questions that you have, we'll be able to answer. Eventually, especially with Dr. Stephanie Hyrdopoulos, will be doing some blogs for us, and so like she does for the paper, so it should be really good.
Okay, so if I had a specific problem, if I say like I had a hip problem, I could go on the website, enter that information, and you would give me a list of physicians that specialize?
We'll give you a list of different doctors in our area that can help take care of you.
Because I looked things up in my phone book the other day, and I didn't have a whole lot of luck because I couldn't find a phone book.
Can't find them anymore, can you?
All right, well, congratulations again, and have a very successful year and a long run if you want to do more than that.
Oh, appreciate it. Thanks, Danny.
I'm speaking with Barry Inman, who is an epidemiologist, and you are probably on the forefront of answering questions in our country right now because Ebola. In fact, you're going to be actually speaking about that. Tell me some of the points you're going to be making.
Well, one about the transmissibility, you have to have a lot of exposure to body fluids for it to be transmitted. Now, it's not transmitted by coughing or sneezing, any of those things. There's no way of transmitting it with this. And you have to have a fever to transmit this virus.
Okay.
And actually, in the first couple of days, it's probably hard to transmit it because we can't detect the virus with the specific tests that we have till after 3 days. So I want to get that apart to people. But also we'll talk about the infection control measures and, of course, possible treatments, of course, with this. And we'll talk about the body secretions that are most likely to transmit it, which is blood, vomitus, and diarrhea in most cases. But any body fluid could possibly transmit it. So we want to get that across, but we want to give them the information about what is most transmissible.
Well, we're talking about a fear factor here, right? And are you going to try to make sure that the public is educated rather than be emotional about this?
Well, that's what we've been trying to do all along, is try to make them understand that it's not that easily transmitted. We've got a lot of other things going on, the flu, of course, that's starting to hit our community right now, and 500,000 people will die of that in the world probably this year, and Ebola is not going to come anywhere near, anything like that, because flu is so easily transmitted. So we try to reassure them of some of the things that we have in place and some of the things that we've improved on as we've learned from this, as we learn from any virus or any infectious diseases, about what things we can do better.